Hello. So, are you one of the 30 to 40 million people who report some form of hip pain on a regular basis? Or maybe for you, it's not about pain, it's just like tightness or lack of mobility as compared to what it once was in your life? Some of us assume that as we age, the hip mobility will automatically decrease or become more limited, and that's actually not the case. Now, for some of us, the hip issues we're having are all about the hips themselves, that is the bones. For example, me. Actually, I just had a successful total hip replacement just a few weeks ago. The great hope is that many of you won't need a hip replacement, but there are some ways to really improve hip mobility, reduce that pain and tightness. And for us golfers, we know that, right? It's all in the hips, so we really want to have good mobility and movement. So today we are going to dive into a few great exercises. We went to work with our friends over at Atlanta Sports Recovery, some of the best in the world at what they do about helping us understand and get that soft tissue more mobilized, stronger, so that we can be faster, fitter, stronger, and all that we want to do, including golf. And we talked to them about hips. Specifically, we learned a couple of assessments that we can do right at home to see if our hips are in gear and where they need to be, and then a couple of simple at-home exercises we can do to improve that mobility and get stronger, so that when it's time to get out there on those fairways and everywhere else in life, we can be better at what we're doing. So we've got some assessments and then some great exercises in part one of this series. Stay tuned. So some of the biggest weaknesses, physical weaknesses I see, are an inability to remain stable throughout the motion, the golf motion. And so what happens is a lot of golfers will recognize that as topping the ball, or you're pulling up. Well, they aren't able to maintain rotation and be strong all the way through the shot. And that's a big deal on the golf course.
All right, so we're looking at Greta's hip internal rotation here. So that's your ability for your hip to go this way. Earlier she was talking about how hip rotation and the lack thereof can affect your golf swing, and it manifests itself as topping the ball. So this little test right here is a measure of that hip rotation that you can do at home. It will help show if this is something that you need to work on or if you're good. So what you want to do is lay down flat on your back, have somebody bring your hip up into what we call 90 degrees of flexion, so a 90-degree angle here at the femur, and then we want to rotate the hip this direction. And my measurement here is going to be the tibia without any hip lift or like a catawampus here. She should be able to get 45 degrees here. Don't break the knee, by the way, trying to force the leg in here to internal rotation. You can see with Greta, this is her bad side. We are, what we'll say, grossly lacking hip internal rotation, which means that if she's topping the ball a lot, it could be likely related to that. Greta's such a good pro that she's definitely not topping the ball, even with bad hip mobility. But you at home, try this out, and then if you don't pass the test, check out the next video for some ways that you can work on this at home. Hey, what's up? It's Coach Johnny from Lateral Sports Recovery. I'm here with Dr. Greta, golf pro. We'll fix your game if you need help. We're talking about hip internal rotation, and I just wanted to show this quick test that you can do at home to see if you have enough of it to be a good golfer. You're going to stick a foam roller, a ball, something between your legs. You're going to be seated. Your femurs should be at like a 90-degree angle to your torso. Don't sit in like a recliner or something where your knees are up higher. And then you're just going to rotate your leg like this. Ideally, we can get about 45 degrees of hip rotation here. Dr. Greta won't be able to get this because she has osteoarthritis in her hip and is getting ready to have some surgery on it. But we just wanted to show you guys kind of what it looked like when you have complete hip rotation. So earlier, Greta and I were talking about topping the golf ball and how the lack of hip internal rotation can kind of cause a situation where your hips can't fully clear and get through, and it will cause you to come up and turn. So this is a banded, lateral banded distraction that you can do at home that will improve this hip internal rotation. The setup for it is really easy. All you need to do is get a band all the way up in your hip like this, and then Greta's gonna rotate her foot this direction. You can see that's enough for Greta right there, that her hip immediately starts kind of popping up or elevating, and that's because she's missing that internal rotation. She's gonna sit back towards her heel just a little bit. And if you have a hard time keeping your foot from rotating, you can either get a friend or a weight or a kettlebell or something, and then just block your foot in this direction. And Greta's just gonna hang out right here, and once that stops feeling pinchy and sticky, then she can move her leg even more in this direction. Again, she's got osteoarthritis, so we're not gonna force the issue, but she's gonna go as far as she can, and she's gonna hang out here for 2 minutes. 2 minutes is super important. That is the minimum effective dose for this.
And it's Dr. Greta here with Johnny and the team at Atlanta Sports Recovery, and we've been talking about a lot of things related to hip rotation and movement and making sure that we can make sure we improve our swing and get stronger. So one of the things that I've noticed with a lot of my clients, particularly young and developing girls, is an inability to keep the hips square and the knees are kind of buckling in. And so Johnny, when I was talking to you guys about that, you were kind of breaking that down from a more technical standpoint. Can you go into that?
Yeah, so ladies especially have something called a high Q angle. And the Q angle is the relationship of your hip to your knee. So luckily in Western culture, and I think most cultures, we find a high Q angle attractive, right? Unfortunately, it's not great for hip stability. So what we see a lot of, and this isn't just in golf, a lot of in jumping and landing as well, is as we go to create force, the knees buckle in like this. So the solution for fixing is pretty simple. You take a band like this, you can get one of these on Amazon for like 10 bucks, put it around your knees, and we're gonna do what we call a lateral band walk. So you're gonna get in like a baby squat position, and then force those knees to stay out, and then just start walking side to side. I know you've been doing a ton with Allie. We're working on Greta's hip stability prehab for surgery. Again, you grab one of these and then just do like 3 sets of 50 feet in each direction. Do that all off season long, and we'll get rid of that kind of knee cave that we see that is also a lot of times coincides with loss of habit. So fix your golf game by using a silly band. It's awesome.
Awesome. Hello again, it's Dr. Greta here with Johnny and the team at Atlanta Sports Recovery. We're still talking about how to get your game to a higher level by getting stronger and getting fitter. So right now, Johnny is going to demonstrate a simple, just plain old strengthening exercise to help us get our body and our game in gear. So Johnny, you want to tell us a little bit about what we're about to do here?
Yeah, so this is a movement that I love for golfers. It's a kettlebell hip rotation strength exercise. So not like a specific name like bicep curl or something like that, but it's just going to strengthen your hips' ability to rotate and also build some core strength.
Okay.
2 very important things to golfers. So what you need for it is just a simple kettlebell. The weight you want to select is something that you can do with appropriate form. And so men especially have a problem, right? They go to the store and they're like the 55 pound. I can definitely do that one. This is a 26. I train all the time, and this is what I would use. This would challenge me. I could go for 3 or 4 months with this kettlebell doing this movement, and then still be hard.
So someone kind of new to this.
So a fella, let's say, if you're new to this, never done it before, 20 pounds in that neighborhood, lady, like 10 to 15.
Okay, perfect.
So, you should be able to get 10 to 15 reps of this without performing. All right, so the move is pretty simple. We want to stand in a split stance. Left foot forward, right foot back to start. We're going to bring the kettlebell up. Very important that the arms stay locked out. And then we're going to do some rotation. I'm going to try and not hit Greta here, but I'm going to rotate away from my body like this, and then come back down. Again, arms got to stay locked. Look at the hips. They're rotating up and then back. And this will translate very, very, very well to the rotation that you have to do in your golf, right? So super simple thing you can do at home. If you did it 3 times a week, 3 sets of 10 to 15 reps, you will see massive strength improvements come springtime when you're back out on the course hitting bombs.
So thanks again to our partners over at Atlanta Sports Recovery. The information about how you can get in touch with them is listed right below. In the meantime, I hope that you'll put those great tools and exercises to use. And don't forget, part 2, we're going to focus on how to get stronger through the back, what we call the thoracic region, and how we can assess and make sure that our mobility is where it needs to be and that we are nice and strong. So see you in the next video.